Hey, how's it going, everybody? We're back again with Adrian. The last time
What's
that we
up?
spoke was like a year ago, the
Yeah.
exact same event. We were at the Cal Cairo Fall Conference 2023. This time it's in Napa. Last year we were in San Diego. And since then, it's been a whole year. As you may know, at chiropractic school, a lot happens in one year. So, Adrian, tell us where you were last time we talked and where you are now.
All right. Let's see. So I'm in Q10 now, so I was about Q6.
Mhm.
Just a whole lot of academics. I think I was prepping for boards one
Around, yeah,
ish, something
sounds about
like
right.
that. A whole lot of academics, a lot of book work, definitely.
Mhm.
Didn't even, not gonna lie, didn't even think of being this far in a sense that like the things I'm thinking of now, like preceptorship,
Right.
clinic, and all that good stuff, it seemed very, very far away. But
Mhm.
now in Q10, it's a balance between clinic and studies.
Yeah.
Fortunately, the studies have gone down a lot. It's more so clinic,
Okay.
and now I'm looking to see where my preceptorship is.
Nice.
So
Okay.
it's a whole different ball game, and get to work with patients, which is a lot more fun than sitting down reading a book the whole time.
Mhm. Mhm.
um, and yeah, and it's nice too because the schedule's a lot more free, I guess.
Nice. Yeah. And have you taken any other boards yet after part one?
I took part one, and then I took PT about a month ago.
Okay.
I just found out I passed this morning,
Nice.
so
Congrats.
thank you, bless
Yeah.
up for that. And then I'm taking two and three next year, and
Cool.
then yeah, four next year too.
Yeah. So it's just for the people out there, like you need to get all parts of the boards done in
Mhm.
order to get your chiropractic license.
Yeah, so all there's four parts and a PT part.
Mhm.
Um, Part one is kind of the gatekeeper. Once you pass that,
Right.
it kind of unlocks the other ones, and then you also have to keep in mind the scheduling. So unfortunately for me, part four is happens 2 months after I graduate.
Ooh.
Yeah, so that, and
Wow.
because they only offer it, I believe, twice a year.
Oh wow. Yeah.
They're in the works of changing it,
Yeah.
but as it stands right now, since the schedule hasn't released,
Yeah.
yeah, for any Cairo students out there, look ahead, kind of plan it around that. I think they offer twos and threes. I want to say
Yeah.
about two or three times a year,
Okay.
something like that.
Yeah.
So try to play around that. And there are academic, um, I guess, requirements you have to do before that.
Okay.
But part one, get past part one,
Yeah.
and see what happens for part two and three.
Yeah, part one is mostly a lot of the heavy sciences. So a lot of the
Mm-hmm.
things that you learn in the first year, your physiologies, your
Science, science,
cardio
yeah,
stuff, all that. Yeah, that makes sense that it's like going to be, you have to know all these sciences first, and you could, everything else
right.
chiro related, you'll take.
And then they were saying part two is was it like the clinical stuff,
Yeah.
and then part three is actually applying the clinic stuff in a clinical vignette. They say,
Okay.
and then part four is actually you're working on a mock patient.
Yeah. Good.
So
So you have some clinical experience now under your belt. You've
yeah.
done you're in student clinic and you've done outpatient clinic.
Hmm.
What is that like?
Um, so for at least for our experience at Palmer, uh, it's I want to say adrenaline rush
Mm,
almost. Student clinic is nice because you're working with your peers
right.
and there's not too much pressure there.
Right.
But the moment you step into outpatient clinic, it's a whole different beast.
Hmm.
Not to say that student clinic doesn't prep you,
Right.
but once you see your first patient, especially a new patient, if you don't know, and they are looking to you as a primary resource, as
Hmm.
a source of like somebody who knows what they're doing,
Hmm.
and that is also a very scary or slash adrenaline rush, a source of authority, better yet.
Right.
And so it's scary, but it's fun.
Mm,
Like it's you know what you know,
right.
kind of thing. And once you get past like, the first few minutes of like, oh my gosh, new patient, new patient, new patient,
Hmm.
you get in that guess you get in that plan and that role, and you're just like, all right, just like any other patient, whether I know you or not.
Right.
Um, you have this, so I'm going to do that instead, or this, you display this, so I'm going to work on that.
Okay.
Yeah.
Would you say that treating your outpatients, is it like what you expected it to be?
Um, to be honest, not really.
Mm,
So in student clinic, Fortunately, because we're working with peers, we do a lot of adjustments.
Mm-hmm.
Like our primary focus is adjustments. Like, oh, so when your cervicals are out, or you need a thoracic adjustment. I've been studying all day, so my lumbar is out.
Right.
Um, but when I made the move to outpatient, I noticed my adjustments went down a lot. Not to say I'm not doing any adjustments,
Okay.
but due to insurances saying that we can adjust them, or we have a clinician adjust them,
Yeah.
or what happens to me often is some patients, they only want modalities. So a patient would come in, they'd get only shockwave, or they'd only get ultrasound or something like that.
Yeah.
So we're still treating patients, yes,
Yeah.
but we're not like giving them adjustments.
Okay.
So that's something that I didn't expect.
Yeah.
And yeah, that's something definitely didn't expect to happen. But fortunately, we still have a lot of time to meet the minimal requirements for graduation. So.
That's good. Yeah. So you're in 10th quarter now.
Mm-hmm.
He has like 3.5 quarters, something like that,
something
to go.
like that, yeah.
And then, yeah, after that, it's gonna be out there in practice. Then you mentioned that you're gonna be looking for a precept at some point.
Yes.
Have you had any thought into that? Do you want to stick around the area? Like, what kind of practice you want to look into?
Definitely. And I also recommend anyone toward the latter end of the program to start thinking. It's always good to start early and thinking about it.
Mm-hmm.
It gives you more time to filter out what you do like, what you don't like. Fortunately, with Art said, we also started early, especially last year at last Cal Chiro.
Yeah.
And yeah, I kind of want to stay in the Bay Area, just because my family's out here. But hopefully, I can get established here, and then once everything's good and out here, then expand somewhere, maybe in SoCal, Hawaii, somewhere. I don't know.
Nice.
Keep my options open, which is another very important thing to have, just that flexibility.
Yeah.
But because all my roots are out here, I know a lot of people. There's a lot of connections out here.
Right.
So definitely want to use that to my advantage in this time. And also in terms of what I want to find, I always definitely encourage shadowing places. If you can vibe in a place, I think that's worth a million. Because if you're going to be there for what preceptor, you roughly push at preceptor level, you're pushing like 25-ish hours a week, if not more. And it's just like any other job. If you don't like the people you're working with, you can have a very bad experience.
Right.
So definitely encourage shadowing, meeting other doctors, see how they like. If they match your flow, if they match your vibe, they have stuff you like. Like I'm over a very modern aesthetic. I know it's very superficial, but
no, that's
it's something. Yeah, exactly. It's something that I look forward to. Like if I'm in the, I'm more of a t-shirt kind of practice versus dressing in a suit or a tie every day.
Right. Yeah.
Like I can do it. That's fine. But my personal preference is like more relaxed, more, more chill, I guess. And the only way to find out is by going to checking out other doctors, walking their offices. A lot of doctors are super nice about it, super chill. And the more you see, the more you're like, oh, I like the way this doctor does that, but I like the way this doctor does this better, and so on and so forth. And so when it does come that time when you want to pick, or even when you graduate and you want to start your own practice, you know exactly like, oh, you know what, I don't like tan walls. I want to go with blue, so you're gonna have blue walls.
Yeah.
Just even those small details, you'd be surprised how much the small little details add up in the long run to know what you want to go for and what you want to do and how you want to build your own practice.
Yeah, for sure. That's I think that's like one of the more important things, where it's like you're comfortable, especially if you want to own your own practice. You want to be comfortable in that space. No, because if you're comfortable, you're comfortable with the patients being there also.
Exactly.
You have that environment.
And especially if fresh out of college or fresh out of school, it will be stressful. That's it. Everyone I've shadowed, they're saying it's going to be a rough first 2-3 years, and that's acceptable. I understand that, but as you're saying, it's if you're comfortable with position, you're already taking off like 50% of that stress.
Right. Yeah.
You're good. You're working with good folks, or you feel comfortable. You feel at home.
Yeah.
And you can perform your best when you're comfortable. So
for sure. You're a member of the Palmer Center for Business Development.
Yes.
Right.
Yes.
Did I say it right?
I say it so much about the acronym that I don't remember what it means sometimes. But
it's like that. Palmer Center for Business Development.
PCBD. Close enough. Yes.
Now that they've held some really good events in terms of like meeting potential employers, getting people to come in and talk about businesses, starting a business and whatnot. So we've been exposed to a lot of good things. That being said, have you had thoughts about like what are my options? We've so far
Oh, okay.
we've gone into like employment, like you could
Mhm.
work for a company that's contracted with like Google or something and be a
Right.
chiro there, own your own business. You could be an associate. You could work for the government, VA.
Mhm.
You have given some thought to like what kind of path you want to take?
Uh, for me, on a extremely personal level, is I definitely want to work with maybe as an associate at another Cairo,
Hmm.
just to get my feet wet,
Yeah.
especially not to be mean, but like just to gain my patients that way,
Mm,
establish where I am,
okay.
kind of figure out how I want to operate. Eventually, I do want to run my own practice,
Right.
but definitely want something like a brick and mortar to call home.
Right.
I think that's
Yeah.
important.
Yeah.
So I'd like to have that, and then on the side have my own little kind of side practice.
Yeah.
But there's also another one that isn't talked about much. It's called locum tenens or locum tenens. Have you
Is
ever heard
that
of
the
it?
one where you like you fill in for a day or
Yeah,
something?
you're
Yeah.
you're
Yeah.
you're essentially a travel chiropractor.
Right. Right. Yeah.
Um, not to say that I'm not looking at it. I'm not gonna push it out either.
Right. Right.
But it's something that isn't pushed often or seen too often. So
Hmm.
when people hear about it, um, it's like, oh, I know we can do that kind of
Yeah.
situation. So, and I know some other chiros who do that specifically,
Hmm.
and they're striving in that
Yeah.
field.
I mean, if it's something that vibes with you, I think like
Yeah,
yeah, yeah, like you like to travel, you like to go out to your patients. So
and you like the having to experience different locations and
yeah, yeah,
see how things run there. Then it's definitely an option that I think people, if that's your vibe,
right.
by all means, go for it.
It's interesting. Yeah.
Uh,
Yeah. So in terms of owning your own clinic eventually, I know
mhm.
you're a cycler. It's one of your
Yes.
hobbies. You also like play music.
Hmm.
Do you see yourself kind of tapping into those populations, the connections that you have in those areas?
Oh, completely. So before, uh, yeah, I completely planned to do that. And before I like was a cyclist and all that, cyclist, runner, and all that stuff, I was also a weightlifter too. So I'm gonna be
Mm,
tapping into that.
nice.
And because I was doing that at my gym, it created many connections that way.
Hmm.
And I think moving forward in my professional career, and I also recommend anyone in the moving career,
Yeah.
is I got to find that niche.
Mm, yeah.
And the whole, I guess, in a sense, for me, it would be triathlon, and like that would be my niche.
Hmm.
And so that's the best way to move forward. Because it's, again, it kind of go back to being comfortable, right?
Right.
Like if you throw me in a cooking thing,
Yeah.
I'm gonna be horrible at it. Like I'll be a horrible Cairo cook guy.
Right. Right.
But yeah, for in terms of music and triathlon and that stuff,
Yeah.
that is my field, and I feel
Nice.
most comfortable in that. So I'd
And
be able to
you
implement
know
that.
how to treat like maybe injuries that are common in those fields. So that's
Exactly.
good
And
stuff.
another thing is I'll be able to talk to my patients in, it's called like the jargon
Yeah.
that they use,
Yeah. Yeah.
and
Hmm.
that would definitely build confidence in the patient. And that's very important too, because I mean you can see any doctor for almost any case,
Hmm.
but who are you going to trust? The one who doesn't understand your sport at all,
Hmm. Yeah.
but or the one that does your sport and understands the nuances, the pains, like
Right.
oh that's happening, well just adjust that,
Yeah.
or oh fix this a little bit, oh have your back straight more,
Hmm.
like it's really fine tuning your niche. I guess even yeah in the last quarters of school,
Yeah.
uh, could really help set up something good when the moment you get out,
Sweet.
versus being so general, like I can do anything I need to, but
Yeah.
if you don't have that niche, you're kind of like you're one of the many people, like okay cool, I'm just here,
Yeah.
I'm just trying to do whatever I can. um, and that'll definitely help you stand out amongst the crowd.
Yeah. I know some chiros that like they've started out of the gyms that they go to.
Hmm.
I mean, has that been a possible choice? Like you get your own space in the gym and kind of build from there?
Completely. I have a really close friend of mine, um, and he said that whenever I'm ready,
Mm,
I can we can work on negotiation for that.
nice. Yeah.
And I mean, it doesn't have to be 100% like I'm always here all the time,
Right.
but at least having my own personal space can definitely help kickstart mine personal
Yeah.
while I'm working at like another brick and mortar to just get my reps in and then come or go to my own spot to say that I have a spot.
Yeah.
So
Sure.
it's kind of like a satellite, I guess, so to speak, treatment.
Sweet. Yeah. Well, I appreciate you for coming in, man.
No
Thank you.
problem,
Thank you
dude.
for sitting down, taking the time here to talk with me.
Always a pleasure,
And
bro.
it's it's been a journey for both of us, but I'm excited for the futures and what we
Yeah, you're
got
not too
going.
far behind me, man. You soon enough.
We are the last of the last, and we're all just clearing the school out. Palmer West
Mm-hmm.
is closing. If you guys don't know yet, I've been tagging it, but they are closing, and we are the last batches making our way out. So after
Yeah.
that,
No more Palmer
no more
West.
Palmer West.
I mean, I think that's an honor to be a part
Yeah,
of that, like the last class
yeah,
or the last batches of graduates for us.
exactly.
I think
Yeah,
that's super cool.
yeah, it's a good thing to have. Yeah,
Sad, but it's super cool. Yeah.
yeah. Well, thanks again for coming in.
No problem, bro.
Till next time.
Till next time.